Hey everybody, it's Council President Brandon Scott. Just going to give a quick live update on Facebook, COVID-19 update for today. We had a lot of things happen. We know late last night I said that the city should shut down all bars and restaurants, stop all events 50 people or more, and also limit those places, food service places, to just having carry out and delivery. The governor issued some things today we want to run through for the entire state of Maryland. We know that these things are decisions that are not made lightly, but with this pandemic, we have to make sure that we're protecting everyone we can at all costs. So I want to run through these things very quickly. Again, all bars, restaurants, movie theaters, gyms across the state will be closed effective 5 p.m. today. Drive-through delivery and carry-out service can continue. Gatherings larger than 50 people are prohibited. Utility companies, something that we called for, the council called for last week, may not shut off service to residential customers. They also will not be assessing any late fees, and tenants will not be evicted during the state of emergency. These are difficult developments, but they're necessary. The most important thing we can do right now is protect our citizens at all costs. We will make it through this together. We can survive through this, but we have to do that responsibly and by heeding the advice of public health professionals and doing what they say. We cannot continue to allow ourselves to be suspect to helping this virus spread throughout our community. So these are why these things have to happen, and we have also still pushing to try to figure out ways for those impacted businesses and those workers to be taken care of during this most stressing time for them. Again, I want to thank all the bars and restaurants that did that on their own, so that we could see leadership from them as well about protecting their residents and protecting their customers, even though it will impact their bottom line. The latest statistics that we have, there are 37 total cases in Maryland, 1 in Anne Arundel, 1 in Baltimore City, 1 in Carroll, 1 in Charles, 1 in Howard, 4 in Baltimore County, 2 in Harford County, 10 in Prince George's, 15 in Montgomery, and 1 in Talbot. Those numbers will increase, everybody, but it is not a time to panic. We can make it through this. We've made it through things in Baltimore, the Great Fire, the British, riots in 68, unrest in 15. Together we will make it through this if we are being responsible and working together as a community. That means heeding the advice of public health professionals, making sure that we're looking out for our seniors and our vulnerable populations, especially those with pre-existing conditions, but doing what we're supposed to do to protect ourselves and our neighbors. That's how we're going to make it through this. We have resources that are also available for lots of things. I'll run through that very quickly. MTA is still running. They are still running. They're making sure that the buses and the trains and transport is cleaned every day. You can get that information on mta.maryland.gov/coronavirus. The Department of Planning has an interactive map of the meal sites across the city. We're going to make sure that you can find that on our Facebook timeline so that you can see that. City schools, emergency food distribution sites are open March 16th through March 20th, 10 a.m. to 2 p.m. The sites are open for young people, clearly, but also persons with disabilities over the age of 18 who participate in school programs for people who are mentally or physically disabled. Department of Transportation suspending ticketing of vehicles for street sweeping parking violations, along with 48-hour parking violations in the city, effective immediately. So also make sure to spread that information. Again, steps we can all take. If you're sick, stay at home, first and foremost. And we also have to understand that we do not want people rushing out to try to get a test. First thing you do, if you get some of the symptoms and you're feeling bad, fever, coughing, shortness of breath, and in more severe cases, pneumonia, which you will feel in your lungs, call your health care provider first. Allow them to help you make a decision. If you don't have a doctor, please call 211 for a list of clinics, and people will be able to help you. The vast majority of people will recover from this infection. Most people will have mild or moderate symptoms. Older people and those with pre-existing conditions are the ones who are at greater risk for more serious illness. That's why we have to avoid contact people who are sick. Cover your cough and your sneeze, throw tissue away, wash your hands with soap for at least 20 seconds. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touch objects and surfaces consistently and using standard cleaning practice. And again, if you're sick, stay at home. We don't want people rushing out to the emergency room. We want to make sure that we can work together as a community, looking out for our neighbors, making sure that people are doing the right thing, because we can make it through this together, Baltimore. It's not a time to panic, but we will be here pushing out the information consistently, and unless anyone else has questions, we are going to end the live feed for now and come back and put this information out for you guys to have consistently. Thank you.